Will I lose weight after SIBO treatment? And of course, nothing that I ever have to answer is as simple as yes or no. So the answer is sometimes. SIBO is a hugely challenging condition to get rid of. And I'm sure I've done presentations on this. But it is, it's small intestinal bacterial overgrowth. And it comes in a lot of different varieties of like mild, moderate, and really severe. It's highly dependent on going away on a lot of different things, and it can cause a lot of different things. I just happen to have this here, not because I'm doing this, but because I see it so much. I actually have graphs to help people to explain what SIBO is and what SIBO can cause. And certainly, of all the things that SIBO can cause, diarrhea, constipation, foul-smelling gas, not foul-smelling gas. It can cause your gallbladder to not to work. It can certainly cause inflammation, prediabetes, chronic pain, different types of anemias, depression, and it can cause weight gain. Okay? So my point here is, yes, it can cause weight gain. There are other things that can cause weight gain. And there's thyroid that can cause weight gain. There's blood sugar problems that can cause weight gain. There is stress. Chronic stress problems can raise cortisol, and then that can raise leptin responses, and then your fat cells won't go away. There's chemical toxins that can cause weight gain. So the point being, SIBO can cause weight gain. Now the interesting thing is, they're all like this. They all kind of play together, or can play together. So it just depends on the person. It depends on the person. So the way we attack it is we attack SIBO. And if the person comes into me and we have an entry form that we have that patient fill out, and if weight loss is like on top of their list, certainly have attention on that. And so as we walk through the process, which is not the same for everybody, as you can imagine from what I just got saying, there might be different modes of attack on that particular person's SIBO problem. And if all that gets under control and the gas and the bloating, the stench goes away, they're able to eat starches, fibers, and sugars again. And SIBO can affect your gut. It can affect bacteria in the gut that alter blood sugar. I just said that's one of the reasons. If the blood sugar stabilizes, that maybe they're losing the weight. It can alter brain function. If that stabilizes and calms the person down, they could be losing the weight. If they hit a wall, then at that point in time, then we go on to address the specific area that now becomes a little bit more obvious. Like, let's say it's blood sugar. Let's say we're doing SIBO and the person's like pre-diabetic or even diabetic, type 2, but let's just say they're pre-diabetic. That's going to cause you to not be able to lose weight. At this point, the SIBO's gone. We're now going to go after the pre-diabetes. Maybe we're going to use a keto diet, and maybe we're going to use a keto diet with intermittent fasting. But that's how it goes. It's not as simple as, okay, I'm going to get... Now, could you just get SIBO under control and have the person lose weight? Absolutely. Absolutely. So that's... And again, I'm bringing this out because everybody's looking for that, everybody goes online and they're looking for that one shot. Okay, I do this, and my weight's going to go away. And it could go away, absolutely for sure, if you figure out how to get rid of your SIBO. And it may not. But if you're overweight and you have these other issues, I will say this, you pretty much have to get rid of the SIBO first for you to be able to address some of the other issues that would be causing you to not lose weight. So that's my experience. Again, this is basically me sitting here sharing with you my clinical experience that I've learned over all these years in treating patients and just seeing what works and what doesn't work. So could you lose weight by correcting your SIBO? Yes. I'd give it 50-50, maybe. I would say 50-50. You correct the SIBO, you're going to lose some weight. Maybe you don't lose all the weight. Maybe you lose some of the weight, not all the weight. And I'd say 50%. It's like you take care of SIBO, you still have the weight, you haven't lost it, but that usually can be a very good first step in someone who understands what the next steps would be towards your weight loss.